right, welcome back to ABA exam review and the continuation of our RBT practice exam series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out btexamreview.com for all of our study materials, including our famous combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A door starts to squeak in your house, so you walk outside and grab some WD-40. You spray the WD-40 on the hinges of the door, and the door no longer squeaks. You start to keep WD-40 in the closet by that door. What is the likely consequence for spraying WD-40? All right, so we're looking for the consequence of spraying WD-40. Now, if we look at the question, right, you walk outside, you get WD-40, and here's the response. You spray the WD-40 on the hinges, and as a result, what happens? The door no longer squeaks. So our consequence is the door no longer squeaking. But the question is more specifically asking about what kind of effect is that going to have on your behavior? Because when we talk about consequences, we want to know how is it affecting your future behavior? Well, now you're keeping WD-40 in the closet by that door. Why? Well, if it starts to squeak again, you can grab the WD-40, you can spray it on the hinges, and what's going to happen? The squeaking is going to go away. And that's the key idea there. What is the consequence of spraying the WD-40 on the hinges? Well, you're taking away the squeaking. The door no longer squeaks. You're removing the squeaking. However you want to say it, you are taking away that squeak. And as a result, you're now putting WD-40 in the closet by that door. So your behavior is changing in the future by increasing, one, putting WD-40 in the closet by that door, and two, likely spraying WD-40 on hinges when they squeak. So with that said, what is the likely consequence for spraying the WD-40? A, positive reinforcement. Well, we just talked about the consequence. You're taking away something, right? You're removing the squeak. The door is not squeaking anymore. So it's not going to be positive because positive means we've added something. So it has to be negative. So we can't pick A. We also can't pick C because, again, it's not positive, it's negative. So now we have to decide, is it reinforcing, punishing? Well, what are the chances that you use the WD-40 in the closet in the future when the door squeaks? Probably pretty high, right? Because you took away the squeaking. So if you're going to continue doing it in the future, it's not punishing, rather it's reinforcing. So if you put the two ideas together, negative taking away, reinforcing, the consequence is likely B, negative reinforcement. Claire sings out loud her favorite song when it is on the radio in the car with her friends. Claire also sings out loud to her favorite song when she is in the shower or when she is by herself in the room. What is likely the primary function of this behavior? When we have a function question, we want to start thinking about the environment where the behavior is occurring and the antecedents and the consequences. Now, there aren't a lot of clear antecedents. It seems like being in the car with their friends and the favorite song might be an antecedent. In the shower might be the antecedent, by herself in the room. It seems like Claire is engaging in this behavior in a lot of different situations. Now, what does it seem like the consequence of this behavior is? Because remember, the function is why the behavior is occurring, or what's the effect on the environment, or sometimes what's maintaining that behavior. Well, she's with friends, so when she's singing with her friends, maybe it's attention, but it could be sensory or automatic, right? Claire sings out loud when she's in the shower, presumably by herself, right? So if nobody's around, it's likely not attention. She's probably not singing to escape the shower or gain anything. And then she sings by herself in the room. So she's in all these different situations where she's with her friends. She doesn't need to escape. She doesn't need to get anything. When she's by herself, she's not trying to get attention. She's not escaping anything. All these different scenarios, she's engaging in this behavior, presumably just because it might feel good. And so when we do something when we're alone and it doesn't seem like the consequence is being delivered by anybody else, what do we call that function? A, tangible. Well, in none of these situations does Claire appear to be gaining an item or a tangible, so it's likely not A. What about B, attention? Is Claire singing for attention when she's by herself in her room or in the shower? It doesn't seem that's the case, so let's not say B. What about escape? Well, Claire doesn't seem to be needing to escape in any of these situations. So it's very likely this behavior is automatic, or as it's commonly called now, sensory. It feels good. The consequence is not socially mediated. the likely function of the behavior is D, automatic. A speech therapist evaluates a child who is 10 but still often says things like nanner instead of banana. The speech therapist tells the child's parents that they should no longer respond or provide tangibles when the child speaks inappropriately. What is the speech therapist recommending? Let's think about this. We have a child who is 10 but is not speaking correctly. So, nanner instead of banana, maybe baby talk, as you might call it. So, what the speech therapist says is, well, when the child speaks like this, don't respond, don't provide tangibles. What does that look like to you? Well, to me, it looks like before, if the child said banana incorrectly, they might get the banana as reinforcement. Now, the speech therapist is saying we're not going to do that anymore. So if you're withholding behavior for previously reinforced behavior, or excuse me, if you're withholding reinforcement for a previously reinforced behavior, what do we call that? Because in the past, incorrectly speaking, produced reinforcement, maybe in the form of a banana, and now we're no longer providing that reinforcement. So what are we recommending? A, negative reinforcement. Well, we're not removing anything as a consequence of speaking inappropriately, and we definitely don't want to increase inappropriate behavior. So the speech therapist is very, very unlikely recommending any sort of reinforcement procedure. What about positive punishment? Well, the consequence isn't adding something. We do want to decrease speaking inappropriately, but we're not adding anything. We're withholding. And that's the key word with extinction, which is C. We're withholding reinforcement that was previously given for the behavior. Now, what about D, differential reinforcement? It doesn't seem like we're differentially reinforcing anything because we're just putting the behavior on extinction. There's no alternative here. There's no different targets. It's just instead of reinforcing inappropriate speaking, don't do it anymore. Don't respond. Don't provide tangibles. So the speech therapist is saying withhold reinforcement or put the behavior on extinction. If you wanted to conduct a preference assessment for a brand new client who is 15 years old and female, which of the following strategies would be less recommended? So think about the wording, right? We're looking at strategies that are going to be less recommended, meaning maybe some of these are okay. We're going to look for the best answer, meaning the one that we would not recommend compared to the other three. And so we're going to conduct a preference assessment for a 15-year-old and female brand new client. A, sit down with the client and ask them about their preferences. Does that seem like a good way to do a preference assessment? Absolutely, especially with a 15-year-old. Now, we don't know the developmental level or their skill level, but asking the client is always a good idea, especially when it comes to preferences. What about B? Search the internet for popular items all 15-year-old females enjoy. Is this better or worse than A? What's going to be worse? A is very individualized. We're asking the client directly. B is looking for an item list for all 15-year-old females. Well, are all 15-year-old females the same? Of course not. So B is not as good as A. So let's look at C. Ask her parents what they usually provide as rewards. It seems like her parents would likely know better than a popular item list, especially if they're already using these as quote unquote rewards. So C is still better than B. And then D, examine the client's environment and take notes on what she has around the house. Absolutely. Go to her room, look in her living room. What does she have in maybe the garage? What does she play with on a day-to-day basis? What does she engage with? Examining the environment is a very direct way of looking at preferences and is definitely better than B. So can you get ideas from the internet? Sure. Is it as good as directly asking the client, observing the environment, or even asking stakeholders? Probably not. So what's going to be less recommended is going to be B. Search the internet for popular items all 15-year-old females enjoy. A stakeholder, when used in the context of applied behavior analysis therapy, is anyone who blank. So this term stakeholder can be a little confusing at first because you don't really use it very often. You might have never used it before. When we talk about stakeholders, we're simply just saying who's invested, right? Who wants to see positive change? Who wants to see socially valid outcomes from services? Who's invested in this client? So, what is a stakeholder in the context of ABA? A, anyone who is invested in the outcomes of treatment. Absolutely. That could be parents, siblings, grandparents, teachers, other therapists. These people have an interest in the outcome of treatment. What about B? Knows the client in any capacity. Well, think about that phrase, any capacity. So if you met the client once, are you a stakeholder? Not really, because you might never meet them again. If this client talks to someone at the gas station because they're trying to buy some water, that doesn't make the gas station attendant a stakeholder just because they know the client as a service provider. C works at the ABA company, even if they're not on the case. No, you're not involved in every case at your ABA company. And truthfully, if you're not on the case, you really shouldn't know much at all about the client to begin with. So C is definitely not true. So out of these, a stakeholder is going to be anyone who's actually invested in the outcomes of treatment. Thanks for watching. Be sure to check out btexamreview.com for all of our study materials. Make sure you subscribe. It really helps, and you get all of our updates. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.